Hello, and welcome to the Iowa City VA Healthcare System Virtual Town Hall. My name is Justin Hardt, the Public Affairs Officer, and I'll be moderating the event. This evening, we'll be providing you with updates and important information about VA benefits. We appreciate you taking the time out of your evening to join us to learn more about how the VA can help you. Participating in our town hall this evening tells us that you're invested in what we do, and we could not be successful without your involvement. So thank you again for your time, feedback, and especially your service. To begin, we want to hear your questions and feedback tonight. Feel free to take this time to grab a pen and paper so that you can write down information or any questions you want to ask. To ask a question live during the town hall, press *3 at any time. You'll be transferred to an operator who will take your question and add you to the queue to ask your question live. We understand your time is valuable, so if you'd rather leave us a message and receive a follow-up from a VA staff member, please press *9 to leave a message with the clinic where you receive your care. However, please be aware that by pressing *9 and leaving a message, you'll be disconnected from the call. To field calls more efficiently, we request that you leave your full name, last four of your Social Security number, and a good contact number to reach you, and a short description of your problem or question. Finally, please keep in mind that there are thousands of people on this call. For your safety, please do not disclose any of your personal health information while asking questions. So for our first speaker, I'd like to introduce Dr. Andrea Hayes, our Associate Director for Patient Care Services here at the Iowa City VA Healthcare System.
Well, thank you, Justin, and a big thanks to all of you on the call this evening. Our goal tonight is to provide you with the latest information, answer any questions, and receive important feedback from you. These town halls provide us the opportunity to hear from you directly, so don't forget to press *3 to ask your questions live on the call. Or if you prefer to leave a message for a follow-up call from one of our VA staff members and be disconnected from this call, press *9. To field calls more efficiently, we request that you leave your full name, your last four, and a good contact number to reach you. Also provide a short description of your problem or question. I know that I speak for all our leadership team and employees at the Iowa City VA in saying that it is a pleasure to serve our population of veterans, and I'm honored to be part of the great things that are happening right here in Iowa and Illinois. We want to capture as many veteran voices as we can, so tonight we'll ask you to answer 3 poll questions throughout this call. For our first poll question tonight, we want to know if you are receiving enough information regarding your benefits. If you feel you are getting enough information regarding your benefits, please press 1. If you don't feel you have enough information on benefits, please press 2. Your feedback will help us improve how we communicate with you and is greatly appreciated. For our first speaker, I would like to introduce Scott Meister, a legal administrative specialist with the Veterans Benefits Administration. He will provide a brief overview of the benefits process and explain how he can assist you in understanding your benefits.
Thank you, Andrea. Good evening, everyone. As Andrea stated, I am Scott Meister with the Veterans Benefit Administration, and I'm here to discuss with you disability benefits. As many of you are aware, there are a wide array of veterans benefits offered from the VA, whether it's from the VBA, the Veterans Health Administration, the National Cemetery, or even state veteran benefits. Sometimes navigating to find them can sometimes pose challenges, especially if you don't know where to go to ask or find them. So hopefully by the end of my presentation, you will be able to somewhat more familiar on resources to find benefits you may qualify for. With that, I'm going to turn my focus on familiarizing you with service-connected disability benefits and where to go for assistance if needed. So you may be asking yourself, what exactly is a VA disability benefit? And quite simply, it's nothing more than a benefit that provides monthly tax-free payments to veterans who have what's called service-connected disability. And now you're asking yourselves maybe, well, that sounds great. How do I qualify? So let's break down what a service connection is a little further. The service-connected disability itself is an injury or illness that may be directly related to military service. This can mean the disability was sustained during service, or that a pre-existing condition you may have come into the military with was worsened by service. The VA is going to be looking for that link between the disability and the service event in most cases. To qualify as well, you must have active duty service, served in active duty for training, or inactive duty training to be eligible. Let's talk about the disability itself, the current disability that some of you may have from the military service. This is quite simply the injury or illness must be current and affect the veteran's mind or body. And plainly, that just means you have to have a current diagnosis for the disability in most cases. That really helps substantiate the claim. So let's say you receive a disability from the Veterans Benefits Administration. You must be at least 10% disabled by a service-connected injury or illness to receive compensation. As the percentages arise, so do the pay rates increase. We'll take some time now to talk about maybe in some cases where you need to provide evidence. For the most claims, or most of the time, evidence is going to be collected by the VBA if you get your health care at the Veterans Health Care Administration. But in some cases, veterans may need to submit medical or lay evidence to support their claim. Medical evidence includes doctor's reports, medical test results, and it can even be lay evidence, statements from yourself, family, or friends when you're really looking to substantiate that claim. Not all claims are black and white, and that's why I'm mentioning the lay evidence. But again, if you receive care at the VA, the Benefits Department will automatically upload VA records to assist developing your claim. Otherwise, a release is sometimes needed for the Veterans Benefits Administration to develop for your private medical records outside a government facility. And there's some other factors to consider when filing a claim. Certain chronic conditions that appear within 1 year of discharge from active duty service also might be eligible, so don't ever rule yourself out, such as high blood pressure, arthritis, diabetes, peptic ulcers, etc. Anything that would manifest itself within that year of getting out. So many of you are asking yourselves right now, how do I get the process started? And there's a number of ways. We'll go through those right now. The fastest way is on va.gov website. Once you're there, you would select the disability link. It's right there on the va.gov website. This link will populate a series of questions and then will automatically generate a completed application where you'll be asked to submit electronically when you're finished. Again, completely automated, and on average, it takes 20 minutes to file a claim online. But some of you might be thinking now, well, Scott, that's fine and dandy, but I'm not good with a computer. Well, we got you covered there too. If you don't prefer to use the va.gov website, you can always use county veteran service officers or veteran service officers that are available to assist you. One of the easiest ways to find one is to contact your nearest county administration building and ask to speak with their Veterans Affairs office. You may also utilize nationally accredited service organizations. Those service organizations are organizations like the Veterans of Foreign Wars, the Disabled American Veterans, the American Legion, Vietnam Veterans of America, Wounded Warrior Project, or even the Paralyzed Veterans of America. These are just to name a few. There's many, many more out there you can choose, but these are the main ones. For us, most of the organizations work within the federal building in Des Moines, and some are available in satellite locations. Again, they can be reached by phone and assist you further with benefit-related questions. In closing, regarding any other benefits offered by the VA, I would encourage all of you to utilize the va.gov website. Most of the benefits that we offer are there, or obtain the latest federal benefit booklet. But again, that booklet's online, and you can pick up the latest federal booklet in a number of locations. And or, again, seek a nationally accredited service organization that can explain additional benefits, both federal and state. The VBA has also a call center, so if you have your pen and paper ready, you can call this number to ask benefit questions. And their number is 1-800-827-1000. So again, that's 1-800-827-1000.
Thank you so much for that, Scott. And I want to remind all of our callers, if you're having a medical emergency on the call, please hang up and dial 911. So we'll move on. We have a lot of callers today, so if you want to ask a question live, we're limiting each caller's time to 2 minutes. If you'd like to ask a question live, please press *3. Again, to ask a question live, press *3. So before we begin the Q&A segment, please note that topics such as presidential actions, executive orders, or other matters of national interest are outside the scope of our discussion today. However, we want to assure you that our mission remains unchanged. We are dedicated to taking care of veterans, their families, caregivers, and survivors. Our commitment to providing the highest quality of patient care will never waver. Please remember that there are thousands of listeners on the call, so avoid sharing any personal health information. You may hear a reminder about your time on the line, and callers will be disconnected after 2 minutes. Our subject matter experts will do their best to address your questions promptly so we can move on to the next caller. If you need more time or follow-up, you can always press *9 to disconnect from the call and leave a voicemail. You're also welcome to leave a voicemail at the end of the call for further assistance. Thank you for your cooperation and understanding. Let's strive to be respectful and helpful to everybody involved in the call tonight. So we're going to go ahead and take 1 to 2 questions right now. And our first question is going to be Lisa from Rock Island. Lisa,
Hello.
are you ready?
I am. Can you hear me?
Yes.
Okay. My question is, my husband is 100% service-connected disabled. He's in a nursing facility, and I'm paying out of pocket the full price to take care of him. Is there a way that I can start the process of getting this facility VA contracted? And I ask because I've inquired into VA facilities and have been turned down due to the care that he needs they can't provide. So that's why we're in a regular skilled care nursing facility and paying out of pocket. I didn't know if there's a process or if...
Okay, Lisa, I'm Dr. Sandra Mon. I'm the Chief of Rehab and Extended Care. I'm sorry that you have had to pay out of pocket. I'm going to give you a phone number. This is our contract nursing home coordinator. Her name is Angela, and the number is, do you have paper, pen?
Yes.
Okay. Her number is 319 430-1561. We currently have 22 contract nursing home facilities, and she can provide you with information.
I have the list. What I'm inquiring about is there a way or process to get where he's at contracted by the VA? Is there someone I could talk to about that to see if this could take place?
The facility would have to contact us directly, and it all depends on the area. There are a lot of factors that we have to review and see. So, but call this number, and Angela can provide you with all that information.
Okay.
Thank you.
So next we have Debbie from Rock Falls. She asks, when are the TVs going to be used again in the clinic through the hospital? Debbie, we're happy to have you jump on and comment if you want. So the decision to have the televisions on the care channels was due to controversial topics being on television. At this time, our policy is to have our waiting rooms be healing environments, and at this time, we do not plan to switch back to having television on the TVs. But you can talk to your clinic. The care channel is available in all clinics. Moving on from this portion of our questions, I'd like to introduce Joe Gedkin, our business office manager, who will provide a brief overview of his programs and an overview of how to enroll in VA healthcare services. Joe?
Thank you, Justin. I want to provide everyone on here with some new changes we have with our Veterans Transportation Service, otherwise locally known as VTS for short, and also our Beneficiary Travel Department. So the VA offers transportation through a couple different options. We have our DAV and VTS. And DAV will transport multiple veterans, whereas VTS really prioritizes special mode transportation for veterans confined to wheelchairs and offers a door-to-door service. VTS will also serve ambulatory patients as much as possible based on our availability, the patient's needs, and what drivers we have for that day. Patients have always been able to call VTS directly, but now the VA also has an online self-service portal which you can access at vetride.va.gov. Again, vetride, vetride.va.gov. Patients may also download the VetRide app from the Apple Store and Google Play, and there's links on the VetRide site that you can download for the app. Patients will have to create an account, but once you do, you can request transportation then online 24/7. The travel staff will review the request and really try to work to assist the most patients possible based on their travel and medical needs. Patients that request transportation online will receive notification from VTS if they're able to, approve that transportation request. Patients that don't have the app or online account can still call VTS directly. That hasn't changed. We're just trying to give out other options. But the number for VTS is 855-219-9022. Again, that's 855-219-9022. And VTS prefers that patients would call for transportation needs around 7 to 14 days before the appointment. That just helps us set the schedule a few days in advance to try and serve as many patients as we can. Also, in the travel office, Beneficiary Travel continues to process our travel requests from patients that request them through a couple different options, paper and online. The paper is always an option, but the faster option to receive travel reimbursement is through the Beneficiary Travel Self-Service System, otherwise known as BTS3. You can access that through the portal online or through the check-in process. The best way to getting to the portal, the BTS3 online account, is by Googling BTSSS. It'll take you to the BTS3 home screen. From there, you can track the status of your requests in real time. Also, patients can text the words check-in to the number 53079. Again, that's just the number 53079. If you text check-in to that number, it'll send you in a text the check-in process, and through those steps, you can request travel reimbursement directly through your phone. The online BTS3 portal and the text check-in process are really the most secure and fastest way to request travel reimbursement. If you have any questions regarding the travel reimbursement process, please contact our travel office. You can do that easily, probably the easiest through the My Healthy Vet portal, or you can call the travel office at extension 636356. I also just want to touch on the PACT Act. that was passed August 10th of 2022. Just to reiterate some of the new eligibilities for patients. There's 3 different cohorts. The first one is through the Toxic Exposure Risk Activity. You'll see the acronym TERA, T-E-R-A. And really that's for veterans that were exposed to any air pollutants, chemicals, occupational hazards, radiation. I think sand is also listed in that. The second cohort is our patients that were assigned certain duty locations. So this is any veterans that were served on or after August 2nd, 1990 in Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, or the United Arab Emirates. Then after September 11th, 2001 in Afghanistan, Djibouti, Egypt, Jordan, Lebanon, Syria, Yemen, and Uzbekistan. Finally, there's a third cohort, and these are veterans that had served, were deployed in support of Operation Enduring Freedom, Operation Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, and Operation Inherent Resolve. And lastly, the Resolute Support Mission. So if any veterans are on the call that would be affected by the PACT Act or have any conditions, service connections you would like to file, as Scott was talking about earlier, these are 3 of the cohorts you want to consider if these had affected, if you were part of those 3 cohorts for the PACT Act. Next, I want to ask our next poll question, the second poll question. We want to know about we asked about your VA benefits. Now I want to know what information specifically you'd like. So for more information on health care providers and well-being services, please press 1. If you want more information on VA benefits, such as service-connected disabilities, please press 2. And then for cemetery or survivor information, please press 3. If there is another benefit that I didn't list that you'd like to have more information about, please press 4.
Thank you for participating in the polling question. Now I'd like to introduce Dr. Niru Agarwal, the Associate Chief of Staff for Community Care. Dr. Agarwal will give us a brief overview of the Community Care Program and basic eligibility criteria.
Thank you, Justin. So for eligibility requirements for community care or to get your care in community from other community providers, veteran must meet the requirements. One, veteran must be enrolled in or eligible for VA health care, and veteran have to have approval from VA healthcare team before they get their care from a community provider, except for certain cases like emergency or urgent care. There are other criteria which veteran need to meet. In a simple overview, it is either based on drive time, which is the distance from their closest VA, or on the wait time to increase the access in timely manner. Just a simple example would be like for primary care and mental health, the drive time is 30 minutes and wait time is 20 days. If their closest VA cannot provide them, it's not the closest, or the VA services available near them are beyond these limits, then they are eligible for community care, but it will need approval. And for specialty care like cardiology or any other specialty, the drive time is 60-minute average drive from home to location where VA has that service, or 28 days wait time. In those cases, veteran is eligible and can choose the provider from community. There are some other criteria also which can be applicable even if these are not, which in details you can find at va.gov website. Thank you.
Thanks, Dr. Agarwal. Next, I would like to introduce Dr. Sian Rahman, the Chief of Rehabilitation and Extended Care. She will give us a quick overview of her programs and what they offer to veterans. Dr. Sian Rahman.
Thank you, Justin. So, like he mentioned, rehabilitation and extended care, we do have a number of programs, services that we offer to our veterans, especially our aging population. We do have our home-based primary care program, and this is where the team will go to the home to see the veterans. The primary care team, which consists of an interdisciplinary team, a provider, a nurse, social worker, a pharmacist, dietitian, a mental health provider, if needed, and occupational therapist. So these are usually services provided to our veterans that have difficulty leaving the homes. They have a number of complex medical problems. And you can get a referral through your primary care provider. We do offer 4 programs: Iowa City within 50-mile radius. We have Ottumwa with 60-mile radius of the Ottumwa CBOC. We have our Quincy program, which is also 60 miles from the Quincy CBOC, and in Davenport, which is 35 miles from the CBOC. So those are our 4 programs, our home-based primary care program. We also have, which is the first in the nation, and this is a very small pilot program, a home health program, which consists of skilled and non-skilled services. In other words, a nurse that would go to the home, assist with medications, as well as an aide that will assist with bathing for those veterans that meet eligibility, bathing, light housekeeping, assistance with grooming, etc. So there are eligibility, and also this one, you can get a referral from your primary care provider. The catchment area is 50 miles within our Iowa City main VA. We have our contract nursing home program, which consists of 22 nursing homes in the community. Eventually, we would like to have our own community living center, which would be our own VA nursing home. And we are hoping to have this facility up and running within the next 3 to 5 years. So we also have our extensive rehab department, which they offer physical therapy and occupational therapy. Our main gym is at the Federal Building in downtown Iowa City. We do also offer a very small pilot of our therapists, both physical and occupational therapists that will go to the home. That is within 40 miles of the Iowa City VA facility. Aside from that, we have our pain clinic, and if you are having some issues regarding pain, etc., or would like to come off some of your pain medicines, please also have your provider make a referral to our pain clinic. We have our whole health program. We have our geriatric clinic, which also provides primary care to our aging population, 65 and older, and they're stationed here at the main VA, or we can also provide telehealth to the other CBOCs. And we have our hospice and palliative care program as well. They're stationed here within our main VA, and we can provide services to the other CBOCs if needed, or if someone is in need of receiving palliative care, hospice in the community, those referrals will also be provided.
Thank you so much, Dr. Sam Rahman. Our next poll question, number 3, for our final poll of the night: where do you learn about changes in VA programs and services? For word of mouth, press 1. For online, press 2. If you found out about the VA from traditional media like a newspaper, TV, or radio, press 3. If other, press 4. Again, how do you learn about changes in VA programs and services? For word of mouth, press 1. For online, press 2. If you found out about the VA from traditional media like a newspaper, TV, or radio, press 3. If other, please press 4. Thank you, Dr. Sam Rahman. For our last speaker of the night, I would like to introduce Dan Baltusberger, the Administrative Officer for the Rock Island National Cemetery. Dan is going to give us a basic overview of benefits and general eligibility requirements for burial benefits. Dan?
Thank you, Justin. All right. First, my name is Dan. I am the administrative officer at the National Cemetery. Basic eligibility. Anyone who served before September of 1980, 1 day of honorable service was really about all it took. After September of 1980, for enlisted, would be 2 years of active honorable service, or if you are a reservist or National Guard, basically to be deployed or retire. And then for officers, that rule changed in September of 81. There is also a factor of service connection. If you are service connected at 0, that also gets you eligibility in a national cemetery. Now, a lot of people have questions on who can be buried in a national cemetery. Well, obviously the veteran can be, but the spouse can be buried with the veteran. Unfortunately, if there's a minor child who passes, they are eligible, and that minor child, if they go to college, can have eligibility all the way up until their 23rd year. Or an adult dependent child, and that would be if unfortunately you had like a child that was born with Down syndrome and had to live with you their entire life. Now, they must become an adult dependent child before age 18. That's very important because, some people might have an accident and when they're 21, say, and they would not be eligible even if the parents took care of them after that age 18. Also, the adult dependent child cannot be married or have children, but they did change the rule if that adult dependent child would get divorced, then they regain their eligibility as long as they didn't have children. The types of burials that we have, also, if you marry a veteran, so if it's a veteran to veteran, you both are entitled to your own spot. And when the first veteran passes, we reserve a spot right next to them, so that way they can still be together but still get their privileges of having their own spot. The types of burials that we have casketed burials. That can be just a traditional casket, or if you buy your own private vault, we can accommodate both of those. And urn burials. So that's either an in-ground or in our columbarium wall. One thing to note with that is, if you ever divide cremains, any cremains that are not brought to the National Cemetery can never be added to the cremains. So if there were 2 children and they divided mom and dad's cremains and they buried half, they could not bring those other half after the fact. Also, if you had your ashes spread, you can still get a memorial stone in a national cemetery. You just have to come by and see us, and we will take care of you. If you are buried in a private cemetery, you still maintain certain eligibility for things like you can still get a headstone. You can get a memorial emblem. And you can also, they just, in a previous couple years, they allow you to have either an urn or a plaque. But keep in mind, if you would say get the urn as your burial benefit, that precludes you from being buried in that national cemetery. So you could not, 2 years later, your loved ones could not bring you to be buried at the national cemetery because your burial benefit would have been the urn that they selected. Finally, you can pre-register. There's a pre-eligibility form, but you can also do that online at va.gov. And if you use that for like Express Scripts or something like that, you just log in, and then in the search bar, you can search burial benefits, and it will take you to the link to do that. You will need to upload your DD-214. What I ask folks, especially if there's folks on here that aren't as computer savvy and you're in the Quad City area, please come by and see us. Or I've even had people as far away as Iowa City make trips to see me, and we will help you do that. Now, it is not required to do a pre-eligibility, and if you don't, what I recommend is you get a blue folder, put your DD-214 in there, and just let your loved ones know that your intention of being buried in the National Cemetery. If you have any questions after this, again, my name is Dan Baltusberger. I can be reached at area code 309-784-0000. That's 309-784-0000. And thank you all.
Thank you, Dan. If you're still on the call, I want to thank you for sticking with us. We hope that you have found this information helpful. We'll now transition to the question and answer portion of the call. So on the call, we have got Johnny from Rock Island. Johnny from Rock Island, are you still with us?
Yes, I am.
All right, sir, you're live. Go ahead.
My question is, in the VA in Iowa City, that's a place I can take my denial letters to get them appealed.
Scott, is that an answer that you can help with?
Hi, Justin. Sure. I guess the first question I have for you, Johnny, is do you have a veteran service officer as your power of attorney?
I don't know nothing about that at all. No, I do not.
Do you know how you filed your claim? Or the reason I ask is the VA, when it comes to appeals, and whether it's an appeal, a supplemental claim, what's called a supplemental claim, or an appeal to the Board of Veterans Appeals, the VSO has the legal authority to represent the veteran as power of attorney. So this may be something that you might want to leave your name and number at the end of the call, or by doing the I think it's a star 9 option. Justin can verify that. But leave your information, and I can look in to see who you might have as a veteran service officer. They have the legal capacity to represent you where VA employees cannot. They're not allowed to do the appeals. So I would ask you to do that, and I can follow up with you.
I appreciate that.
Sure, sir.
All right. And just to remind our listeners, yes, if you want to disconnect from this call, provide more information, and have a VA staff member call you back, please remember to press star 9. All right. Our next caller, we have Loris from Cedar Rapids. Loris, are you still on the call?
Yes, I am. I already asked my question, though.
Is it is the question not getting PSA tests during annual physical?
Correct. Yes.
Okay. We have Dr. Sharp.
Yes. Hi. This is Dr. Victoria Sharp. So I'm not sure if you were getting PSAs and then they stopped at a certain time. And I don't know if you were being seen in primary care or like in urology. So I'm based in urology, a specialty, we focus on, prostate cancer would be one of the things. And so in screening, if we look at the American Urological Association's recommendations for screening, then we recommend that we discuss with our patients whether they should get prostate cancer screening. And the screening can be a PSA, but it also could be a digital rectal exam, feeling for like a nodule on your prostate. And in general, we kind of say the ages of 55 to 69. And so those are kind of the age guidelines. If someone has a lot of other medical conditions, then we may say even a lower age. If someone is really healthy and very vigorous, then sometimes we would have a discussion and maybe extend it a little bit longer. And also, if somebody's in a high-risk group, then we may start a little earlier. Does that answer your question?
Well, kind of, except that I had a physical this spring, and I always go in for the blood test and then for the physical with my provider. And then she gives me all of the the results of the blood test, and as I got home, I did not see a PSA on it, as I have in the past. And so I called in, and they told me that because of my age, the VA doesn't require it anymore. And so my question is, if I pay for it, can I have it done?
Well, any kind of testing that is ordered from your, physician or your provider, it's really a discussion between, you and them. One thing is there are risks in getting tests that you don't necessarily need. Sometimes we find false positives, and so we really don't want to do tests that really aren't indicated. So I don't know your specific, circumstance. We can look into it if you wanted to, at the end of this call, leave information, and we could, look into it a little bit more. But in general, it's kind of a discussion between you and your physician. But we don't want to do tests that are unnecessary because of the risks of false negatives or leading to other tests.
So, sir, again, press *9 if you would like to leave your information and have us look into that a little bit more for you, or connect with your provider. So, next caller, we have Richard from Tro Mill. Richard, are you still on the call?
Yes.
All right. Can you? You're live. Go ahead and state your question.
I'm 100% service connected. I was wondering if my wife is eligible if something would happen to me for my benefits.
Sir, this is Scott Meister with the Veterans Benefits Administration. I guess my first question would be if you're receiving Chapter 35 benefits, which is the permanent and total status. Do you know if you are?
Yes.
You are Chapter 35. Well, in that case, here's two caveats to this. First, you would either have to pass away from the service-connected disability or hold the permanent and total disability for 10 years. Then it doesn't matter what you pass away from. Your wife would automatically be eligible for what's called death and indemnity compensation. And that pays not as much as what you're getting now, but it pays around $1,600 a month. And then she'd be also entitled to certain federal and state benefits as well.
Okay. Okay. Thank you.
You're welcome, sir.
All right. Thank you. Right. We will take another caller. We have Alan. Alan, are you still on the line? Sorry. Okay. Sorry about that. How about Carrie from Davenport? Carrie, are you on the line?
Yes, I am.
All right, sir. Go ahead with your question.
Yeah, my question is, for many, many years, I've had a ringing in the ears. I don't know if I can trace it back to being in basic training and being on the rifle range or not. How would I find out if I was eligible for any benefits, disability benefits, because of that?
Hi, sir. This is Scott Meister again with the Veterans Benefits Administration. I would just simply apply. I would apply for the tinnitus, if you will, disability claim. And to do so, what county do you live in?
Davenport, Iowa.
On Davenport. So I would see the Scott County Veteran Service Officer if you wish to file a claim that way through the county, and they can put that claim in for you. I will just add one thing. With the service-connected disability for tinnitus, it is something that usually to be approved had to have started in service, so just keep that in mind. But I would encourage you to go speak to the Veteran Service Officer in Scott County and file a claim for disability for that.
Is there a phone number for that, or?
It's not something I have available right now, but that's something I'm sure we could get to you. They're down at the Scott County Administrative Building, I believe I think it's on 4th, and is it Warren? Warren, 4th and 4th and 4th. 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 4th
Okay, I know where
if you
that's at.
press- Yeah, if you go to the county building, and you could set up an appointment there too if you need to. And the service officer down there would be more than happy to take a claim for you.
Sir, I do have the Scott County Veterans Affairs number. When you're ready, it's 563-326-8723. Thank you. And so we have Alan who's asking about the phone number for benefits. And Scott said that number earlier in the call. If you're ready, it's 1-800-827-1000. Again, 1-800-827-1000. And then Scott, would you be comfortable sharing your extension or how to schedule an appointment with you?
Oh, sure, Justin.
Thank you.
The phone number to the hospital is 319-339-0581, and the extension, or I'm sorry, repeat that, 319-338-0581. That's the hospital's number. My extension is 636244.
Thank you, Scott. Next, we have a question from Teresa Brandon in Cedar Rapids. Teresa, are you on?
Yes, I am.
Can you go ahead and ask your question?
Okay, ever since the sign in to the VA and Social Security has been put into one, I cannot get my husband signed on. And it goes through this procedure, and then you get clear to the bottom of it and goes right back to the beginning again.
Okay. Well, I can tell you about the process and who you can contact here at the Iowa City VA healthcare system about that. There were changes on the sign-ins, so they changed they changed to login.gov or id.me. So you need to choose one of those as your authenticator.
We already did. He's on id.gov.
Okay. Have you talked to Michael Tolis, our connected care person yet?
Michael who?
Michael Tolis. So his last name is Tullis. And he is, yes. And he can be contacted by phone at 319-338-0581, and then his extension is 635101. Again, his extension is 635101. He's also located physically here in the hospital in 1 West 17.
1 West 17. Well, he's seen out here in Cedar Rapids at that clinic, so we've never been down to Iowa City. But I think what the hang-up is, they have his wrong telephone number, and I've tried to change it 3 times, and they keep telling me they changed it, and it still comes up the same. And I think that's what's hanging the system up. And he doesn't use a computer at all, and I'm computer illiterate. So.
Okay. So what I would like you to do is either wait to the end of the call to leave a detailed voice message about your problem, or if you're ready to hang up now, press *9 to leave a message, a detailed message about the problem, and we'll make sure that we can help you out on this. Thank you.
All right. We have our next caller, Kelly in Marion. Kelly, are you on the line?
Yes, I am.
All right, go ahead with your question.
My question is regarding access to medical support outside the hospital. I live in Northeast Marion. To get to the ICVAHCS office and my primary care in Cedar Rapids can take more than half an hour. To get to the Iowa City Medical Center for services takes over an hour. If I go with DAV for any appointment in the medical center, it can take me up to 6 hours to get picked up, transported, and then dropped off again. And so it's hugely inconvenient. I'm a senior. I pay for Medicare. And so my question is, are there any alternatives to that? My dentist is 5 minutes away from my home. There are multiple Medicare and other support medical offices within a few minutes of my home. My eye doctor is provided through community care, and it's 10 minutes from my home here, which makes it incredibly convenient to do that. But any other issues that I have, including dental, to even pick a pair of sunglasses out for support, I've got to be transported to the Iowa City Medical Center, and so my question is, because I'm a senior, I'm 100% and service connected, permanent and total, and I'm on Medicare, is there any plan to allow or support veterans to be able to literally use facilities that are within a few minutes of our home, or do we just continue to have to be sole sourced to the VA Medical Center in Iowa City?
Hi, this is Dr. Agarwal. If you can, at the end of the call, please do leave your contact number and all with *9. But in general, for now, depending on what care you need and based on drive and time and wait time, if you are eligible, then definitely you can choose. But if you are not, then there are different things need to be looked at, and they are very case dependent. So if you leave your contact information, our staff can contact you back and look into your case and see what we can help you with.
Thank you for all of your great questions. We encourage any callers that are on the line, if you have a question that we weren't able to answer, please leave that message and we will get back to you as soon as possible. So that concludes this evening's town hall. Thank you all again for joining us.